Hello, welcome to another episode of Health Check with me, Roxana Gishia, and today we'll be having a very interesting conversation. Yeah, I feel like this conversation has not been talked about enough times, but I don't know. I have a specialist here who is going to tell me if we really need to talk about it more times or it has been talked about enough times. I know some of you might be wondering, what is Roxana talking about? I'm talking about endometriosis. So with me today in studio is Dr. Lulu Mawenzi, a doctor at Valley Hospital in Nakuru City, and she'll be helping us understand what really is endometriosis, what entails endometriosis, and exactly everything in between. Thank you so much. This is Health Check with me, Roxana Gishia. Karibu sana daktari.
Thank you so much.
How are you doing?
I'm fine, thank you.
Karibu to Health Check.
Thank you so much.
So maybe you can introduce yourself to people who really don't know who you are.
Okay, so my name is Dr. Lulu Mawenzi. I am a resident medical officer at Valley Hospital, currently working at Valley. And thank you for having me.
You're welcome. So do you think we've had this conversation about endometriosis long enough, or should we continue to talk about it?
In my opinion, awareness of endometriosis is not many people are aware about it.
Yeah.
Not many people know. There's a lot of myths and misconception about it. So I think, yes, it's a topic that is relevant that we should really talk about.
Okay.
Yes.
So what is endometriosis? I know most people don't really they've never even heard what endometriosis is. What is endometriosis?
Okay, so endometriosis basically means it's what we call endometrial tissue that is away from the lining of the uterus. So what we know is that the uterus has a lining called the endometrium. Okay. The endometrium has tissue called endometrial tissue. So this is the tissue that bleeds every month. When you have your menses, it sheds off. So when we have endometriosis, we're having this endometrial tissue that is in other areas that is not within the lining. For example, you can have this tissue in the ovaries, in the fallopian tubes, anywhere that it shouldn't be, basically. Yeah, so that is what, in a nutshell, that's what endometriosis is.
Does this disease affect both genders, or it's only for ladies because you are the only gender that experience periods?
Yeah. So for this one, it only affects the female patients, because only female patients, or rather females, are the only ones that have a uterus and they have the endometrial tissue. So when you're talking about endometrium, it's only the ladies that can get endometriosis.
Okay. I understand most ladies don't even know, they've never even heard of these conditions. Majority of them, even those who were diagnosed with endometriosis, at first they really didn't know what really is endometriosis and everything. So I'm sure there are ladies out there who experience painful periods, unusual periods and everything, and they just think, oh, periods are normal. So how can someone know that they have endometriosis and not just painful periods?
Okay, so one of the commonest symptoms of endometriosis that we get is chronic pelvic pain. Okay. So we know we have the normal cramping when you have your menses, but for this one, we're talking about very severe pain that usually starts even before you start your period. So you can get like a week before your period, you're starting to get severe cramping pain. Yeah, so one of the main symptoms is actually a lot of pelvic pain that is chronic. Okay. Yes.
So what are other symptoms of endometriosis?
So other symptoms you can get, we usually find that you can have blood in urine. You can also have blood in stool, although this is for when it is really in that severe stages of endometriosis. We can also get pain during sex, what we call dyspareunia. Yeah, so you can get, those are usually the main symptom, but actually the main symptom is actually chronic pelvic pain that is very severe. So you find that when a lady is having her menses, she's not able to go to work, she's not able to continue with her daily activities, some sort of crippling pain.
Okay.
Yeah.
Let's really understand about the painful part. Yeah. On a scale of 1 to 10, how painful should be your periods?
Okay, your periods should basically not should not interfere with your daily activities. Yes. Okay. When you're having your menses, the pain that you should be having, or rather the pain that we can consider normal pain, should be on a scale of 1 to 10 around 4.
4?
Yes, around 4 to at least maybe 5.
Okay.
Also, the pain should be tolerable. It should not be severe pain. It should be pain that you are able to go on with your activities. It should also be pain that you can tolerate, in that you do not need to use medication, yes, to control the pain.
Okay,
Yes.
so when you have those painful period and you decide, let me go and see Dr. Lulu, and apparently you do the checkup and you find, oh, you have the condition and everything. So what is the long life after I have known, I have already been told that I have endometriosis? So do I change my lifestyle, how should I live with endometriosis?
Okay, so one of the things, there's some things you can do to at least make it more tolerable.
Okay.
So most of the time we have medical management. We do there's hormonal therapy, we give you pain medication to help with the pain.
Yeah.
Also exercising, actually. When you exercise for at least 4 hours in a week, research shows that it really helps.
Okay.
Yeah, when dealing with endometriosis. Also, when you comes to having a good balanced diet, it really helps.
And I've had this, I don't know if it is a misconception or something, but again, you're going to clarify it for us. So does endometriosis cause infertility?
Yes, and I would say yes and no. So in women who are found to be having fertility issues, we find that up to around between 50 to 80% of these women end up having endometriosis. So yes, you can have endometriosis and still have children, whereas in some ladies we find that they have endometriosis and they're not able to have children.
Okay.
Yeah.
About misconceptions again. There are people who are told, there are people who complain about their period pains, like it's painful, they cannot manage their pain and everything. So the advice they get from maybe our parents or other people is, you should give birth, the pain will ease. And how true is that statement?
Actually, yes, that is true.
Wow, okay.
Yeah. So we actually advocate that childbearing, anytime you are diagnosed with endometriosis, it is advised, although this is still research ongoing, it is advised that you get children. It helps with controlling your hormones. Yeah, it also helps. Yeah, mostly it's hormonal kind of thing. Okay. So it usually helps, actually. Yes.
Okay. Yes. So you guys, you should be planning. I know the diapers are too expensive at the moment, but if you want to manage your pain and you can afford to take care of your kid, then why not? Anywho, talking about research, how far is Kenya in terms of researching and also taking care of patients who have endometriosis?
So research is still ongoing, although in Kenya, there isn't much going on about endometriosis, but yes, research is still ongoing. It's just that with endometriosis, when it comes to research, in order to diagnose someone with endometriosis, you need to get a biopsy of the tissue and confirm that actually this is endometrial tissue. So when it comes to the diagnosis bit is quite what can I say? It is quite invasive. Yeah, we cannot go testing everyone, doing surgical procedure in order to know whether this person truly has endometriosis. So that is actually the bit that is a bit, it makes us really not to know the prevalence of this endometriosis. Yeah, but at least research is ongoing. Yeah.
So as a doctor, how do you ensure that when a patient comes to your office and tells you, oh, these are the symptoms I'm feeling, how do you make sure you don't miss it? Because most people who have endometriosis, they've said that they went to see a doctor some few years, not even once, not twice, but several times, but they're told, ukizaa utakuwa tu sawa. It's normal. You are a lady. It's normal to have periods. It's normal to have period pain. So as a doctor, what do you do to ensure that you do not miss that symptom, or you do not miss endometriosis in a patient?
Okay, so what usually happens, you're supposed to, when you're seeing a patient, you should take a very good history and a physical exam. Okay. So most of these things you'll get to know. The tricky bit about endometriosis, sometimes the lesions are microscopic. So you might not really be getting anything from your physical exam. Okay. Yeah, that is where the tricky bit is. That's why most of the times endometriosis is actually missed. Yeah, but from the history, when you take a good history, most of the times endometriosis is genetic. So when you get a history that this person, there's a family history of endometriosis, it should ring a bell. We have other things like you can do an MRI, you can do an ultrasound, an intravaginal ultrasound to see whether you can see these lesions. But now, like I said, the tricky bit is sometimes these lesions are so small they are actually microscopic. Now you can imagine. So sometimes diagnosing it is a bit difficult. Yeah.
So I think we should give doctors grace, because your microscopic things are not easy to like spot, you know. But anyway, at what age can one get endometriosis? Is it that there is a certain age, or it can develop with time, or when you get to a certain point then you are safe, or does it just come any point in life?
Okay, so endometriosis mostly affects women within the reproductive age.
Okay.
That is from the ages of 15 to around 44. But sometimes you can get it in postmenopausal women who are undergoing hormonal therapy, like let's say estrogen therapy.
Yeah.
So they also sometimes they might get, but mostly it's women within the reproductive age, which is between 15 to around 44 years of age.
Oh, okay. So you can be 44 and still get endometriosis?
Yes, you can.
That's a bit scary. I thought I have escaped the matrix, but anywho, we have Dr. Lulu here, so we are in good hands. So the other day we lost a hero in the media industry and also in Kenya, Fire Mama. I don't know if you know her.
Yeah.
So she suffered from endometriosis for a very long time. Yeah, and we also have Natalie Githinji, who is still experiencing the same even today, and it has been a conversation, because most people really didn't have a conversation about it. We really didn't understand. We really didn't take much care of them. Even the dad came out and said he really didn't support his daughter during that, because again, I wouldn't blame men, because they don't really understand what we go through. But the struggle that Natalie was talking about was getting the hospitals having the facilities to take care of people with endometriosis. Fire Mama had to travel to go seek medication outside country. We also have another person who missed her visa, and she was supposed to go again for surgeries in another country again. So as far as endometriosis and facilities in the hospitals are concerned, what are we doing about it?
So endometriosis as of now, what we have is medical management and a bit of surgical management when it comes to the very severe cases of endometriosis. So unfortunately, there's not really a cure, because you can imagine these are abnormal cells growing where they shouldn't be. So apart from them being microscopic, they can actually be quite big. You can have lesions ranging from between 5 to 10 millimeters.
Wow. Okay.
So sometimes in such cases we need surgical management. So for endometriosis, for those with severe cases, we actually advocate for surgery. Because maybe if we can talk about maybe the pathology a bit. So I actually have a photo over here.
Okay.
This is just a photo of a normal. Okay, this is not a normal one. A normal. This one we have some endometrial lesions.
Okay.
I don't know whether you'll be able to see.
Yes.
So there's some blackish lesions here. So this is what we call the endometrial tissue.
Okay.
So it's endometrial like. So you can imagine when you're having your menses, what happens is that there is shading of this inner lining, which is the endometrial tissue.
Okay.
Now you can imagine all that is happening also in these areas where you're having the abnormal tissue.
Okay.
So they behave kind of like your uterus when you're having your menses. So they can actually bleed. Actually, they do bleed. But now the tricky bit, you see, when you bleed, and it is this lining of the uterus, there is a way out through the vagina. But you can imagine if it's here, which is the commonest area where you get the endometrial lesions on the ovaries. So if you get a lesion here, you can imagine where will this blood go to? It's just bleeding. It will cause scarring around this area. It will cause sometimes even here on the fallopian tube. It causes a lot of scarring. So sometimes when you actually get infertility, sometimes it can even block your fallopian tubes, because there's a lot of scarring. You can imagine every month there is scarring, there is bleeding, and then after that it heals, and then there's a scar. So that keeps happening, and then it keeps growing deeper and deeper. It causes blockages. So there's a lot of blocking and scarring all over. Sometimes you can even get the lesions on the outer part of the uterus, which should not be there.
Okay.
Now, when it comes to surgical management, at least we try to remove the very big lesions, maybe on the ovaries, on the fallopian tubes, to try and return to the normal female anatomy.
Okay.
Yeah. So sometimes that's the tricky bit. The other part, we do medical management, which we use hormonal therapy.
Okay.
Yeah. To try and at least control your hormones, because what actually contributes to these endometrial tissues growing and developing is the normal hormones that we have in the body.
Okay.
Yeah.
So I'm looking at that image and I'm like, oh my God, so this happens. And when it causes the blockages, because it's growing, it's like a growth. It's growing and it's not stopping. And if it does, it's gonna grow again the next month, the other month, because again, we experience periods every single month. Yeah. So where is the trickiest part you've ever seen the endometrium what?
The endometrial tissue, yeah.
Yes, the endometrial tissue grow.
Well, it can grow anywhere.
Even in your eyes?
Yes. There's actually a case whereby there has been a growth of an endometrial tissue in there, but that is very rare.
Okay.
On most occasion, what happens, it grows around the pelvic area.
Okay.
So it can grow on your bladder, which can cause blood in urine, because you can imagine it's bleeding.
Yeah.
So sometimes when you go to the loo, you can experience some blood in urine. It can even grow on your large intestine, the rectum. So when you're going for a long call, you can actually have blood in stool because of some endometrial tissue.
Okay.
It can even grow on a CS scar.
Wow.
Yeah. So sometimes anywhere that is exposed, anywhere near the endometrial, that's the commonest area that we get these lesions.
Okay.
Yeah.
Okay. So hey, this is scary. It really is scary. Is there a way we can prevent from getting the condition?
Okay. So we can actually, like I said before, we can do exercises.
Okay.
Yeah. There's no a way I can say 100% you'll not have it, especially when it comes to genetics. You know, there's no escaping genetics, unfortunately. But one of the things that research has made us to know is that when you do exercising, cardio exercises around 4 to or even more than 4 hours in a week, it usually tends to help a lot. When you take a balanced diet, it tends to help a lot. So mostly we found that it's exercise.
Okay. Yeah. So what patient is the youngest that you've ever had endometriosis?
I would say 18.
18.
Yeah, 18-year-old.
Wow. How was it for her? Like, was it she just entered the hospital and then you're like, now you have endometriosis? How did she take it? How do these patients take it? Because this is a condition that, again, most people don't really understand it. Even let me just give an example. If right now you're experiencing abnormal periods and you're telling your mom, oh mom, I'm feeling some pain, siwezi osha vyombo, siwezi fanya ABCD, I cannot go to work today. And most people don't really understand, because you can only understand when you get through the pain, you know. So most mothers don't really tell you, oh, let's go to the hospital, nakwambia tu acha kujifanya. So how do they take the news when you give it to them?
It's actually it's not good news, of course, breaking it to them. Yeah, so it's a bit difficult because this is something they have to live with. Yeah, at least until they get to menopausal age, because at least from there, the hormones are down, at least we get some improvement. Okay. But for these other times, we just advocate that we manage the pain, we do hormonal therapy. Okay. So it's not easy, but it's a bit manageable.
Okay.
Yeah.
So what can you tell a young woman who maybe doesn't have endometriosis, or maybe doesn't know yet they have endometriosis? How can you tell that woman, either young or old woman, to take care of themselves, to maybe, what can you tell that woman?
Okay, so I can tell them, number one, if you know there's a genetic predisposition for endometriosis, maybe your mom or your sister has endometriosis, it's good to know that you're likely predisposed to have endometriosis. So you should really be keen when it comes to monitoring your body, you know, knowing, like, just there's these telltale signs when you're having really this chronic pelvic pain that's not going away. Also, for ladies who experience shorter cycles, they are at risk. Also, for ladies who experience long menses, Yeah, at least there's some ladies who go for up to even 7 days.
Yeah.
So they're actually more predisposed. Yeah. So it's just to know, you need to know your cycle, you need to know after how long. Those things, they really give us a telltale sign. So when you know you're having shorter cycles, prolonged menses, you should actually just pay more attention to your body, go checked out, see a doctor. Yeah.
You've talked about periods, and I'm surprised now. I feel like I know nothing about periods. How normal should the period cycle last?
Okay, so ideally, it should be between 21 to 28 days.
Yes.
Yeah, so anything shorter than 21, you are likely predisposed to. Yeah, or even 21. It's still normal, but it's a shorter cycle. So you're more at risk. It's not that everyone who has a short cycle has endometriosis, but you're likely to get endometriosis when your cycle is short, and also when it's really prolonged, let's say 7 days. But normal is between 21 to 28 days. You can even go from even 2 days to 5, even 7. But when you're getting to 7, you're talking a bit prolonged.
Yes.
Yeah.
So I just want to check my calendar cycle right now, because you're going to do a diagnosis right now on air. So before I open my calendar, those people who experience irregular periods, are they at risk of getting endometriosis?
Not likely. What is known is just the shorter cycles and the very prolonged. But the ones who have irregular, these people usually tend to have hormonal imbalances, up and down. So unlikely, because what happens is when you're having a surge of these hormones, the progesterone and the estrogen, this is what encourages the endometrial tissue to grow. Yeah, so when you're having irregular menses, not really, your chances are a bit lower.
Okay. Yeah. Opening my calendar at the moment, and I'm a bit shook because I can see it's not a regular number, like it's not a one number, because I can see 27 here, I can see 28, I can see 30, 31, 30 again, 30, 33. So where am I? Should I come to the hospital right now?
Okay, so for you, that's actually normal.
Okay.
Yeah, so it doesn't, your periods actually sometimes they range from 28, 29, 30, 31, 32, 33. That's still normal, but it should not go past a week. If your cycle is 28, after 28 days, you should be counting at least between the next 1 to 5 days, you should be having your period. So if maybe it surpasses more than a week, goes past, now that is irregular.
What if you get periods twice a month?
That is irregular, because I'm imagining twice a month, that would be less than 21 days.
Yes.
So anything less than 21, that is irregular also. Yeah. So normal periods should range between at least 28 to around even 35 days.
Okay.
Yeah.
So as we are concluding this, I think you guys, I'm sure every lady has a calendar. I'm not sure. Do you have a calendar?
Yeah, personally I do.
If the doc has a calendar, I'm safe. All of us should have a calendar. So I think you should download that calendar. It will help you monitor your period dates when you're ovulating. Again, I think we should talk about ovulation.
Yes.
So what happens during ovulation, and at what point does ovulation occur?
Okay.
Yeah.
So ovulation occurs on the 14th day.
Yeah.
So let's say like a normal cycle of 28 days, it occurs on the 14th day.
Okay.
If your cycle is about, let's say 32, so you count 14 days from the end. Yeah, so you go backwards 14 days. So that is the area that you're likely ovulating.
Okay.
But let's take the normal, which is 28 days. Okay. So around 14. Yeah.
Okay.
Yeah.
So I've had people who say that I got pregnant when I was in my periods. So that means she was ovulating on her period. How crazy is that?
Okay, so what happens, maybe this person, I'm trying to imagine, the lifespan of the sperms inside the reproductive organ is 1 to 5 days. Yeah. So from that day, the sperms can stay alive for up to 5 days. So let's say this person who has a 21-day cycle ends up having sex, let's say on day 7, let's say day 9. She's likely, because by the time these 5 days, we would have gotten to ovulation. So these sperms are still actively swimming there, waiting for an egg.
Okay.
So that's basically usually happens. Yeah, but it's quite rare to actually get pregnant when you're actually having your menses, but it still can happen, because what happens, sometimes there's this other egg that is coming out from this other side. Yeah, that is a bit quicker than the
other one.
Yeah. So, but the most likely cause is that this person the sperm stayed there active. So she maybe had sexual intercourse from around day 7. So by the time 5 days are over, we are around at day 11, 12, which is actually the time this person is ovulating. And also people who take who use contraception, you cannot really tell when you're ovulating. So you might think you're having just a normal menses, but maybe it's just some hormonal imbalance because of the hormones that you are taking. So sometimes it can actually happen, but
because
rare.
you've mentioned contraceptives, I think we are talking about everything, but guys, why shouldn't we? So what are the safest contraceptives to take?
Okay, so the safest that I usually advocate for, actually you are allowed to choose number 1, so you should start there. You should actually choose a contraception that is good for you, contraceptive. So the one I usually advocate for is the IUCD. The reason is the copper IUCD has no hormones. So it just blocks the passage. So you rarely get things, the side effects like bleeding on and off. You rarely get side effects like weight gain, high blood pressure. There's actually some ladies, when they start using contraception, they start getting high blood pressure. So I think, for me, the one I advocate for is IUCD. But again, you should choose a method that is good for you, because not everyone who uses these other hormonal contraceptives get side effects. So there are actually some people who it works well for them. And if it works well for you, good.
Well and good.
Go
So let's
ahead.
talk about students in campus. There are people who are very active in sexual activities, and most of them are shy to go to the hospital and ask for the contraceptive. They don't really go and start, number one, learning their body, what works for them and what doesn't work for them. So the easiest thing to use is P2.
Oh, okay.
Every weekend, kila Friday, mnachukua kama njugu. Okay. We'll forgive you for that, but how safe is P2?
So actually, you're only supposed to take P2
twice a year.
Maximum twice a year.
Wow. Okay.
That is the maximum. Anything above that is too much. So what happens with P2? P2 is actually just the normal oral. You see the daily pill. It's like the daily pill, but now it is like 10 times the dose.
Wow.
That's why it's when you take it once, it's able to prevent at that moment. But what does it do to your hormones? It gives you a surge of hormones. So it can actually give you hormonal imbalance, which can even make you not to get children in the future. So we don't advocate for it, because mainly because the dose of the hormone in that one emergency pill, it's too much. So that's why it's only for emergency purposes, which is not more than 2 times in a year.
So I think we really are understanding our bodies as women, and also if you're not a woman, of course you have a daughter somewhere, you have a sister, you have a mother, you have a grandmother, and I feel like this conversation is very important to understand a woman's body, because this is something that happens every single month. We don't have a choice. It just happens naturally, if you like it or not. But now, what can you tell someone, what's there that we've not talked about, can you say about matters endometriosis? What have you left?
Okay, so just know your body. It's good to have a calendar, know your cycle. Just pay attention. You'll just know. Most of the times, you'll know that my periods are too painful. I'm not experiencing what my peers experience. You are in bed all day because of your periods. That's usually not okay. You can also have other symptoms like blood in stool, blood in urine. When you see such things, it's good too. But basically, the commonest symptom is the chronic pelvic pain. And also the bit to remember is that it happens before. So you may start getting very painful cramping a few days or even a week before your periods. So that's usually also a telltale sign.
So I understand you work at Valley Hospital. So if one wants to come and visit you and get the diagnosis and checkup, how do they get to you?
Okay, so currently now, yes, I'm working at Valley Hospital.
Yes.
Yeah, you can also reach me by my personal cell. Yeah, or even you can come by and visit us at Valley Hospital. Yeah, you'll surely get me there.
So give us the direction. To go
Alright.
town, tumeland CBD, Nakuru CBD.
Okay.
How do we go from
All
there?
right. So I'm sure we all know KFC
Yes.
or West Side Mall. So when you get to West Side Mall, just opposite. When you just opposite on the other side.
Okay.
Yeah, you will Valley Hospital is
You will see it. You will see it. You can't miss it.
Yeah,
Someone
sure.
told me if you really want it, you can't miss it.
Yeah.
So if you're really looking for Valley Hospital, you cannot miss it. You've said about your personal cell. Are you comfortable sharing it?
Yeah, I'm comfortable sharing it.
Here's your camera.
Okay, so my number, you can actually reach me on 0718 059 450.
Yeah, so for everybody who needs medical attention, even away from endometriosis, just any diagnosis, just call her up or visit the hospital, that is Valley Hospital. But for now, we're just going to say goodbye. Thank you so much for being with us. This is Health Check with me, Roxana Gishia. See you next time.